Hello friends, today let us start the series of immunology, and the first topic of this series will be the autoimmune disease. It's a kind of immune response where the antibodies are formed against self-antigens is called autoimmunity. It generally leads to the destruction of one's own tissue and causes disease. When the immune cell works against the cell components of the body, it's a problem of self/non-self discrimination. When we talk about the discovery of autoimmunity, autoimmunity was first observed by Metlanikov in 1900 in guinea pig. He injected guinea pig with their own spermatozoa. The guinea pig produced sperm immobilizing antibodies. Autoimmune disease was first observed by Donat and Landsteiner in 1904. They identified circulating antibodies, and that is antibodies in paroxysmal cold hemoglobinuria. There are many characteristics of autoimmune disorders. Autoimmune disorders are caused by autoimmune response. The autoantigens which produces autoimmune disorder in an individual will cause the same disease in an experimental animal when the same antigen is injected. The disease can be passively transferred by the transfer of autoantibodies or sensitized lymphocytes. In autoimmune diseases, an elevated amount of immunoglobulins are produced. There are many causes of autoimmune diseases. The immune system produces antibodies against antigen that enables it to destroy harmful substances like virus, bacteria, toxin, cancer cells. When we have an autoimmune disease, the immune system does not distinguish between the healthy tissues and the antigens, then body sets off the reaction that destroys the normal tissues. An autoimmune disease may result in the destruction of body tissues, abnormal growth of an organ, change in the organ function. There are many types of autoimmune diseases. Basically, there are three major types of autoimmune diseases. First, hemolytic autoimmune disease. Second, localized or organ-specific autoimmune disease. Third, the systemic or non-organ specific autoimmune disease. When we talk about the hemolytic autoimmune disease, it's a clinical disorder resulting in the destruction of the components of the blood. Autoantibodies are formed against one's own RBC or platelets or leukocytes. There are various examples of hemolytic autoimmune diseases like hemolytic anemia, leukopenia, thrombocytopenia. Next. Hemolytic anemia is a form of anemia due to hemolysis. It's a breakdown of RBC either in the blood vessels or elsewhere in the human body. Leukopenia is a disorder in the number of white blood cells found in the blood. It's not actually a disease, rather it's a condition that increases the chance of getting affected by several diseases. When we talk about the thrombocytopenia, it's a deficiency of platelets in the blood. This causes bleeding into the tissues, bruising and slow blood clotting after injury. Here in the diagram you can see the difference between a normal blood clotting process and a case of thrombocytopenia. So here we can see the difference between the two. When we talk about the localized or organ-specific autoimmune diseases, here we can say that an organ-specific autoimmune disease is one of which an immune response is directed towards antigen in a single organ. There are various examples of localized or organ-specific autoimmune diseases. Prominent among them are Addison disease, Graves' disease, Hashimoto's thyroidosis, then myocardial infarction. When we talk about the Addison disease is the disorder in which the adrenal glands do not produce enough steroid hormones. It results when the adrenal glands are damaged, producing insufficient amount of hormone, that is cortisol and often aldosterone. Here in the diagram you can see that the presence of this gland is above kidney and it is regulating most of the metabolical functions of the body. There are also various symptoms which are associated with the Addison disease, particularly when we talk about the skin, we can see the hyperpigmentation takes place. There is a low blood pressure, weakness, there is a weight loss, as well as along with these conditions, we can see that there are some types of gastrointestinal disorders like nausea, diarrhea, vomiting, constipation, abdominal pain, etc. And there can be also a condition of skin vitiligo. Coming on to the Graves' disease, Graves' disease is an autoimmune disease that leads to an overactive thyroid gland. It is due to the abnormal immune response that causes the thyroid gland to produce too much thyroid hormone. Graves' disease is also known as a toxic diffuser goiter. A swelling of the neck and the protrusion of eyes resulting from an overactive thyroid gland take place, as you can see in this coming slide. In this slide you can see that the two conditions are prominent in this autoimmune disease. One is the bulging eyes, which is known as a condition of exophthalmos, as well as there is a condition of diffuse thyroid gland. This can be well picturized in this slide, where you can see when the regulated production of thyroid hormone takes place, we can see that the thyroid cells are producing a regulated production of thyroid hormone, and which is basically regulated by the TSH receptor. When the TSH hormone, which is secreted by pituitary, it gets associated with TSH receptor, these cells, that is thyroid cells, they are activated and they produces the thyroid hormone. And when the sufficient amount of hormone is secreted, it causes a negative feedback control, which regulates the pituitary glands to stop the production of TSH, and hereby the production of thyroid hormone, it stops. But when we talk about the unregulated production of thyroid hormone, when as it is in the case of the Graves' disease, we find that it is an unregulated production of thyroid hormone, because autoantibodies are associated with the TSH receptors, and it does not allow the TSH hormone, which is produced by the pituitary gland, to get associated with it, and thereby there is a continuous stimulation of this these cells, that is thyroid cells, and they continuously produces the thyroid hormone and violating the negative feedback control, and thereby as such this production, it takes place continuously without any feedback or a negative feedback control. These are the symptoms which are associated with the Graves' disease, which basically are exophthalmos, as we have already talked about, that is the bulging eyes, goiter, and there are another associated symptoms which are associated with this disease, as it can be seen in this diagram. Now next autoimmune disease is Hashimoto's thyroiditis. Hashimoto thyroiditis is an autoimmune disorder. People with Hashimoto thyroiditis, the immune system attacks the thyroid. This leads to the hypothyroidism, a condition where the thyroid does not make enough hormone for the body's need. The exact condition of this syndrome is unknown, but many factors believed to play a role. People who get this syndrome often have a family members who have the thyroid disease or an autoimmune disease. This suggests a genetic component of the disease. Now the third category of autoimmune disease is the systemic or non-organ specific autoimmune diseases. Systemic autoimmune diseases affect the whole organ system, body or many organs, and hence it is called the non-organ specific autoimmune diseases. Examples of these autoimmune diseases are rheumatoid arthritis, Sjögren's syndrome, scleroderma, lupus erythematosus, and multiple sclerosis. When we talk about the rheumatoid arthritis, it's a chronic progressive disease causing inflammation. It is triggered by a faulty immune system and affects the wrist and the small joints of the hand, including knuckles and the middle joint of the finger. If the inflammation goes unchecked, it can damage the cartilage, the elastic tissues that covers the end of the bone in the joint. Over a time, there is a loss of cartilage and the joint spacing becomes smaller. Joint can lose unstable, painful, and can also lose their mobility. Here this picture, it shows the format of normal joint as well as that of the rheumatoid arthritis, where we can see that there is a swollen inflamed synovial membrane, and that also causes the bone erosion, and there is the condition of rheumatoid arthritis it generates after this symptoms it develops. This is also the pictorial form. Here you can see that the knuckles as well as the disformation of the bones have taken place because of this systemic disease. When we talk about the scleroderma or systemic sclerosis is a chronic connective tissue disease. This disease has been called progressive systemic sclerosis. Sclero means hard and the derma means skin. Hardening of the skin in most visible manifestation of the disease. The symptoms varies greatly from each person and the effect can range from very mild to life-threatening. Proper diagnosis may minimize the symptoms and reversible damage. This is the figure where you can see that the hardening of skin has taken place as a symptom of the scleroderma. When we talk about the systemic lupus erythematosus, it's a chronic disease that causes inflammation, pain and swelling. It's a skin disease affecting women more than men. It is characterized by the appearance of blood red spots over the bridge of the nose and cheeks. The lesion takes place in the shape of the butterfly. In addition, it can affect the other organs in the body such as kidney, lung, heart and brain. Most patients feel fatigue, have rashes, swollen joints as well as fever. These are the symptoms where you can see that the butterfly rash can be seen near and across the cheeks and nose. There is scarring and the hair loss as well as the redness arises scaly, non-scarring rash on the sun exposed area. When we talk about the diagnosis of autoimmune diseases, we can first go for the autoantibody test. There are many and several tests that look for a specific autoantibodies. Then there is another test that is known as the anti-nuclear antibody test, a type of autoimmunity and autoantibody test that looks for the anti-nuclear antibodies which attacks the nuclei of the cell in the body. We can also go for the complete blood count, where the measure of the number of red and white blood cells in the body it takes place. When the immune system is actively fighting something, the number vary from the normal. We can also go for the C-reactive protein test. Elevated CRP is an indication of inflammation throughout the body. Then the erythrocyte sedimentation rate, that is ESR count, can also take place. This test indirectly measures how much inflammation is in the body. These are the diagnostic measures we can go for the diagnosis of the autoimmune diseases. So these are the references which you can go for further referring this topic, and I wish you all the success when taking this study into the consideration. You can refer some other books also that can help you in developing the concept further and better. Thank you.